Welcome to Plastic Surgery 101 at AJ Plastic Surgery Center, home of plastic surgery. This session we usually use to address emerging questions and issues around the practice of plastic surgery. Since the last time we had Plastic Surgery 101, a few questions have arisen, both from physical and online interaction with our clients. Today, I have 6 questions that I would like to address. You're welcome. The first question that really comes up and have come up in various ways to us is, who is a plastic surgeon? What are the qualifications? How long does it take? In Kenya, plastic surgeons have both undergraduate and postgraduate qualification. Undergraduate qualification is Bachelors of Medicine and Surgery, offered in various universities in the country. After that, you are required to undergo another 5 years of postgraduate training, currently being offered at the University of Nairobi. Then after that, you're required to have 2 years working under a qualified plastic surgeon for you to be a consultant plastic surgeon. Another common question is on the type of anesthesia. We usually say that you either have local anesthesia, regional anesthesia, or general anesthesia. By local anesthesia, we mean that the area that the surgery is being undertaken on is numbed, or what you would go just a field block. So you introduce an agent, in this case a local anesthetic agent, that is going to make sure that the area that a surgeon is going to operate on is let me say numb, is painless. This is usually indicated for surgery that is being done along a very small area, maybe around the eyelid, a small skin tag, a small tissue, so that you don't necessarily have to use an extensive amount of local anesthetic agent that may lead to complication or side effects. A local anesthetic agent can also be used when you're doing large procedures such as liposuction. So you can do your lipo either with local, or general, or regional. When you talk about regional anesthesia, that is, it means you're doing a regional block. Your body is divided into different regions. They say the upper limb, the lower limb, the trunk, the back, the front. So when you're doing, there are specific nerves that supply specific areas. And we use that knowledge to target those nerves so that anything that is distal to that nerve, upon blocking that nerve, can be safely be operated on without any pain, without any feelings. So that is now what we refer to as a regional block. When we use the term general anesthesia, we actually imply that we've totally taken over the function of the body. So we put you under machine for breathing. We take over your sensation, so you are put to sleep. So there's a part of you're sleeping, take over the sensation, take over the work of breathing, and then put you on an anesthetic machine to monitor you. So it's a bigger scale in terms of the anesthetic agent. And each type of anesthetic procedure or anesthetic technique that is being employed comes with different risks and different technicalities. Another common but very important question I get is usually, can we employ different techniques to arrive at a results? For example, can you apply a non-surgical technique to arrive at a result that you would have arrived at when you're using surgical technique? And my simple answer is yes, with a caveat. For example, if you are to do facial procedures, we have a lot of non-surgical facial procedures that will address either tiny wrinklings or sagging of skin, or just the aging features of a face. And there are also surgical procedures that can also address that. And better still, a combination of non-surgical and surgical procedure will give you a better results. So anytime that you are doing a consultation and then you want to better or improve a particular part of your body, you have to discuss with your surgeon whether we would employ a surgical, non-surgical, or a combination. And in most of the time, we would want to start with a non-surgical technique. If it doesn't give you the desired results, or if you want to improve on the already achieved results, then you would graduate to and non-surgical. However, in some situation, you just have to go straight and do your surgical technique and then augment the outcome with an non-surgical. For example, if you have a sagging tummy, separation of muscles, then your cavitations, your co-sculpting, and other different method of non-surgical body contouring will not help you because you have a structural defect. A structural defect can only be sorted by a reconstructive surgery or a surgical technique. The other important thing is aftercare. I get a lot of questions around aftercare, the duration, is it necessary? Can I do it at home? Can I do my surgery and travel? Actually, this is like pleading. If you're not ready to follow post-op operation or to go through the aftercare journey, then I'd advise you to defer the procedure, because procedure will give you about 50% to 60% of your outcome, but the most critical period is your aftercare. If you're doing your massages, your faha, compulsory, your massages, if there's cavitation, wood therapy, you have to be faithful to your aftercare as the way you are faithful to your surgical or during surgery. And it varies. We have plastic surgery is wide, is head to toe, as I said before. So different surgical technique or different surgery will require different aftercare regime. So during your initial consultation, as you're discussing with your surgeon, you have to know what is required of you after the surgery, what is the duration, what is the downtime, what are the do's, what are you going to do in the hospital setting or in the clinic setting, and what are you able to do comfortably at home or assisted therapy. Another common question I get is, how long is the procedure? How long is the recovery? When I usually address this question, I like to address it in totality. So you have to think about the procedure itself. How long does it take? Then after that, how long are you supposed to be inpatient? Is it a day case? Is it a overnight stay? Is it a 2 to 3 days procedure? All that time is important because you are all busy. So you cannot just account for recovery, but you have to account during the procedure. And in some instance, do we have preparation? For example, if you are to go for a gastric balloon, you need 2 weeks for preparation. So you have to account that in the entire procedure time, if I may call it. So average, if it's a simple, straightforward surgical procedure, will take an hour to an hour and a half. And it could be a day case or a 24-hour or a day stay. And it will take you about 5 to 7 days recovery. Mid-level major procedure, let's say from simple to major procedure, then you'd require about a preparation of a day or two. Then the procedure might take between 2 to 3 hours. Typically, these are procedures such as breast reduction, breast augmentation, simple lipo, a mini tuck. So that's a procedure that will take about 2 hours to 3 hours, depending on the complexity, how big, big the size is, and if there's any underlying issues. And then recovery will take between a day or two in the hospital. Post-operatively, that will push between a week and 2. So if you're doing multiple procedures, or what we call cocktail of procedures, or a very complex procedures, then you expect that such a procedure to take about 4 to 6 hours, sometimes 8 hours, of course within the safe limit. And then in hospital stay, you'll do 3 to 5 days, depending on how quickly you're going to recover. Because as a rule, you're not supposed to leave the hospital until you are independent. You're able to do simple tasks by yourself. And then for that recovery, I'll put it between 2 and 3 weeks. So if you're a busy person, if you have to take your annual leave, you have to travel. We get patients traveling from different parts of the world to Nairobi. So as you're planning your traveling, so you have to really discuss and know how long are you going to do aftercare, how long are you supposed to stay or do hospital visit after your procedure. The other thing that we need to discuss, and also we usually get during our consultation, is the risk and complications. I'll be lying to you to tell you that plastic surgery has no complication or risk, because like any other surgery, as long as you're doing surgery, you're exposed to complication. As long as you're under anesthesia, you're exposed to complications. So there are those complications that are associated with the surgery itself, or the anesthetic agent, and the drugs they are in, as simple as drug reaction. So during the initial consultation, this is where you do your risk profile. And the reason for doing risk profile is so that we can do your risk stratification. If you're a high-risk patient, then we're going to roll you over to a physician or a specialist that is concerned with the underlying issue. Because this being a cosmetic procedure, you want as much as possible to make sure that as you plan to undertake a procedure, you do it in a safe manner, so that we don't assume anything. And you have to be very, very open and very honest with your surgeon as you're doing your initial consultation, because whatever a surgeon can only predict your risk and can predict your outcome depending on how much information you share. So if you share all the information and you're open about either your previous surgeries, previous complications, any underlying medical condition, then it helps someone who is taking care of you to make an informed decision and aid or make sure that your procedure is done in a safe manner. So when you go to anesthetic complication, you have as simple as drug reaction. You can have challenges with, let's say, the equipment. You can have challenges with, let's say, for anesthesia, apart from the drug reaction, in the drug interaction. So if you're on any other medication, you have to share with that. And then for surgical complication, it can be as simple as sometimes you have bleeding, which has to be addressed. So we'll have that discussion with your surgeon. Collection of fluid, whether what you call hematoma or seroma. You have skin issues because you are cutting, so you can have issue with the skin healing. When you're doing liposuction, you can have a lipoburn, you can have skin necrosis, you can have infection. So you have to adhere to your prophylaxis antibiotic, that is the antibiotics that you take after a procedure, all the way to even a tissue loss or a clot. So that time that you're undergoing to do whatever procedure that you're going to do, you have to make sure you have that the risk profiling and risk stratification, and what do you do if you're a high-risk patient. Then by the time you're going to do your procedure, you're very aware, you're very informed, and then you know exactly where do you lie in terms of risk profiling. This has been another very lively episode of Plastic Surgery 101 at AJ Plastic Surgery Center, home of plastic surgery. For more of such videos and more testimonials, educational materials, you can visit our YouTube channel, AJ Plastic Surgery TV, on your screen. Visit our Instagram page, also on your screen. Visit our Facebook page, our TikTok pages, and of course you can call us on the number on your screen, or WhatsApp 24/7, and we are here to answer this and more questions.